OB-GYN doctors say they're watching a disturbing trend in rural America. Doctors who specialize in that care are closing their doors because they can't turn a profit. Jessie Cohen shows us one program successfully teaching first responders how to fill the gap.
There's no telling how long it will take for emergency personnel to get to you when you live in rural America. That's why a program here in Mississippi is working to be a model for the rest of the country to get pregnant people and their babies the help they might desperately need.
There's a lot of pressure on emergency personnel to prevent and to save. But in rural America,
this is I like to call it like our portable ICU.
Those responding
right here, we've got an umbilical line kit.
Don't always have vast experience.
Do you have any major medical problems?
Yes.
Especially when it comes to pregnant and birthing people.
So we take care of a lot of people that live in rural communities. There are a lot of emergency medicine departments that don't have obstetrics available.
From 2004 to 2014, 9% of rural U.S. counties lost all hospital obstetric services, leaving slightly more than half of rural counties without any.
What is scary, though, is that these problems aren't getting any better.
There's a big desert of health care in our state.
Over 50 counties in Mississippi don't have obstetric-trained providers. Pregnant mothers and their newborns are dying. Okay, this is not anything unique to Mississippi. We have huge issues with maternal morbidity and mortality across the country.
Dr. Rachel Morris and her team are trying to change this, starting with a solution in her state of Mississippi.
We're one great example of where access to care makes a difference.
The University of Mississippi Medical Center is providing both classroom style,
sweeping the arm out, rotating,
and real-life scenario instruction to emergency responders, nurses, and providers in small, rural hospitals to prepare them for emergency situations pertaining to pregnant people and their babies. The training's short name is STORK.
My water broke.
Okay, what time did your water broke? A couple of hours ago?
They use high-tech simulation tools to create real-life, pressure-filled situations for those learning.
So what would you say is the most common mistake when people don't know how to properly do this and they end up in a rural area and a mother is giving birth?
Sure, so panic. That's what everyone does.
That's why whether it's someone's first time learning or a refresher,
this is our isolate.
Emily Wells, a nurse practitioner on the neonatal transport team, says this training provides them a level of crucial preparedness that could lead to life-saving measures.
It's seconds, really. The second that you're able to realize something's wrong with a mom, if you can intervene quickly, you can save that mom and baby. So it is truly seconds. UMC has actually been a fantastic resource to the state because we have our neonatal team that can go out and pick patients up. We have our air care team that can mobilize and be at those small community hospitals.
Dr. Tara Lewis started her career in obstetrics and then made her move to emergency medicine.
We have people on a daily basis get transferred from 2.5 hours away.
She sees the direct impact distance and time can have when it comes to birthing situations. Lack of experience adds to the concern.
Some may only have 2 ambulances in their entire county that covers a 60-mile span.
In the U.S., about 24 people are dying per 100,000 live births, which makes this country an outlier among other industrialized nations. Our maternal mortality rate is several times higher than other high-income countries.
It's getting at that training that brings people a level of comfort, maybe a level of muscle memory where they know the steps to try and prevent, an unnecessary emergency.
This is already saving Mississippians. On a larger scale, it stands to benefit even more families. Jessie Cohen, Scripps News, Jackson, Mississippi.